is the Emergency Medical Minute.
So every now and then, we get these kind of, diagnoses that I think we can all kind of smile and nod and, oh yeah, we know all about your disease, and then really we come back and Google it right as soon as we get to our computer. Recently had a patient who came in with Behcet disease or Behcet syndrome, which is one of those things that we don't see very common. It's not a very common disease, but it's Behc with this kind of weird little Turkish symbol on it, and then Behcet. I thought it was Behcet. All right, Behcet, but it's Behcet. It's also called Silk Road disease, but it kind of, and that kind of comes from where the patterns of where these usually come from. So kind of along the ancient silk trading routes, the Mediterranean through Asia, that's kind of where most people's kind of ancestry comes from that have this disease. It is a vasculitis. It's an autoimmune disease. Those are kind of just want to talk about some of the basics to know about it and really what would apply to emergency medicine, which she had a couple of things going on. So basically, like any autoimmune disease, you treat it with some kind of immunosuppression, usually steroids. What's a little bit different with this particular vasculitis is a lot of these syndromes will affect just the small vessels or just the large vessels. This is one that affects all vessels of all sizes. So as a result, you can get pretty much any organ system involvement. Now, the way it's diagnosed is usually just based on symptoms. They tend to get these recurrent aphthous ulcers, really annoying canker sores in their mouth as well as genital tract. And if they start to get a recurrent pattern of that, usually at least three times a year with significant outbreaks, that kind of leads down the diagnosis. But they tend to get other, system involvement, and commonly, there can be some unusual skin rashes, some abdominal issues. A lot of ocular problems can come as a result of that, just for all the blood vessels that feed into the eye. And then rarely there can be some, cerebral findings where they can get, strokes or thrombosis or other issues as a result of that. So, it's relatively straightforward to think about in the sense that it's just a vasculitis, it's an autoimmune disease, but as you can imagine, it can affect pretty much any organ system. So you kind of have to take their complaints pretty seriously as far as if somebody had that and some really severe unusual headaches. Not something you just kind of treat with some meds and blow off without any imaging or workup. Lady we had recently had run out of her steroids, and so she'd been off of them for 3 to 4 days, and so as a result, things were starting to flare up again. If it's just purely a flare and you can get her back on their steroids and feeling better, it doesn't require admission. But in her case, the other issue going on is she was very hypotensive. She was kind of 60s to 70s systolic, and so you have to think pretty broadly. One, they're immunosuppressed. Is there some kind of infection? We have to go down our whole sepsis pathways. But the other is also just adrenal insufficiency. They've been on steroids for a long time and then withdrawn from that. So, this particular gal, she probably runs low anyway. She's pretty small. And it looks like her baseline is probably close to 90 systolic anyways. But as a result, fluids that made no difference in her blood pressure, added hydrocortisone. It looks like after a few doses of hydrocortisone overnight, she was able to get off pressors and doing okay with that. But really nothing else kind of showed up as far as why she was so hypotensive. And she wasn't particularly symptomatic, I think, because she wasn't markedly far off of her baseline, if that makes sense. So, as a result, it's kind of an unusual disease. We don't see it very commonly. I don't think there's a lot of value to learn every zebra that's out there in medicine as far as we have to know everything about it. But if you can know some basics, it can really guide treatment. And like I said, adrenal insufficiency is something that we see commonly. And when you see hypotensive patients that are not fluid responsive, you should often have a very low threshold to give steroids, particularly hydrocortisone to help out with that. So that's it.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.